Thank you for joining today's webinar, Reenergize Your Financial Foundation, an RCM Success Story from Syracuse Community Health Center. Our speakers today include Amy Ellingworth, Chief Financial Officer with Syracuse Community Health Center. Amy has 15+ years of financial experience working for a Big Four accounting firm for her first 5 years of her career. From there, she spent more than 5 years as a director of finance at a regional health system, and then in healthcare consulting until joining Syracuse Community Health Center in May of 2018. As CFO, Amy has responsibility for billing, finance and reporting, data analytics, IT, and health information management. We are also joined by Carol Jones, billing manager with Syracuse Community Health Center. Carol has worked for Syracuse Community Health Center for over 20 years, much of which is in her current role as billing manager. Reporting to the CFO, Carol has responsibility for third-party payer contracting, billing and coding, and the front-end revenue cycle, inclusive of registration and insurance verification. Prior to working for Syracuse Community Health Center, Carol worked as a billing supervisor for a community hospital in upstate New York. We are also joined by Mark Miranda, RCM Client Director with NextGen Healthcare. Mark is a passionate leader with 10 years business experience leading improvement in physician practices and federally qualified health centers. His work spans across multiple areas of revenue cycle, including financial reporting and analysis, payer contracts and value-based risk agreements, practice management system implementations, and process improvement. Mark is motivated to improving efficiency and profitability for community health centers so that they can deliver on their mission and providing the best care to everyone in their community, regardless of their ability to pay. With that, Mark, I'll turn it over to you.
Thank you so much for that introduction, Lori. I'm really excited to introduce Amy and Carol from Syracuse. Amy, Carol, whoever wants to go first, could you tell us a little bit about yourself and your role at Syracuse?
Okay, thank you very much. We're very pleased to be part of this. Is my role in billing manager at Syracuse Community Health Center. I oversee the billing and coding staff. Basically, we are certainly responsible to be working with our providers and our other clinicians to make certain that everything that is processed certainly correctly according to compliance and regulatory guidelines. But we also make certain that by working with the providers, we maximize our reimbursement from third-party payers. Our staff works with the providers on a daily basis to make certain that everything is submitted properly and timely. Once we have these claims moved over from the EHR, they go to our holding tank. From that holding tank, there is one other quick review. From that, we release these claims and they go over to RCM. RCM also would work with scrubbing them. They, in turn, would send things back to us. They would return them to us as claim prod errors that would give us the opportunity to review them. Again, turn them around with a 24-hour period to make certain that the claims are processed timely. The staff certainly is able to work, again, with the providers to make certain that these claims do go out. And following that, the resubmission, say the claim prod errors, they are sent out over to TriZetto. TriZetto in turn will certainly process the claims. If there are any denies, they would be going back to RCM. RCM in turn works them as a level 1 task. If there's an issue with that and they are not able to correct those claims, they do come back to my billing and coding team. Our billers and coders basically make certain that they review what the errors are. They in turn follow up with the providers, working their daily work log. I oversee the entire workflow process, making certain that we have a standard process in place from start to finish at the beginning and the end of the day. certainly the key role for our billing and coding staff is having these claims processed in a timely basis, making certain that the edits that are in place are correct and working properly. And that's with the assistance of RCM, that we're able to make certain that we are maximizing efficiency with the processes that are being set up. Also, another piece of this is the fact that RCM works with the health center in processing all of our remittances. One of the features, again, has been the inception of the electronic remittances as well. So once this cycle completes, in turn, when payment is received back, the cycle really is closed. So I have covered basically from when the patient is seen is to when the provider sees the patient, completes the visit, has it move over from the EHR to the holding tank, from the holding tank to RCM, and then from RCM into TriZetto, back from the third-party payer to TriZetto, then back in turn to the health center. This kind of is like the life cycle of a patient visit, which is something that we have established here at the health center. And basically my role as manager is to not only work with our staff here, but to work very closely with our RCM partners. The RCM staff is a dedicated team, and we work closely with them to make certain all of these processes flow very evenly, and also that they're very consistent and efficient.
Thank you so much, Carol, for that explanation in your role. It doesn't sound like an easy job, and you really explained the relationship between Syracuse as well as NextGen and the RCM services. So thank you so much for that explanation. And then we also have Amy. Amy, please introduce yourself and also tell us a little bit, Amy, about the Syracuse Community Health Center, including like number of locations, providers, specialties, and anything else that you're doing in the community to help patients.
Yes, hi. Thanks for requesting this call today. We appreciate it. My name is Amy Ellingworth. I'm the CFO here at Syracuse Community Health Center. I've been here for a little over 3 years. The functions that report to me include financial accounting and reporting, IT. I also oversee health information management, our 340B program, and then most specifically, the reason for this call is the revenue cycle, billing, and reimbursement. Syracuse Community Health Center has 3 locations within the city of Syracuse. Those are our clinics, and then we have 8 school-based health centers located within 8 of the Syracuse City school districts, which includes elementary, middle, and 1 high school. We've also started working at a couple other locations, most recently since the pandemic started, and that is a men's shelter that we provide services at. And we have also recently started working with the local community college, providing primary care and behavioral health services. So in addition to primary care, we do offer behavioral health and dental. In total, we have about 65 providers, and that's across our continuum of services. And we see over 100,000 encounters per year, approximately 30,000 individual users.
Thanks so much, Amy, and appreciate that backdrop, which helps us move into the next slide that we have, which is let's dig into some of the financial challenges that you might have, specifically also maybe some organizational challenges with an FQHC and a community health center of your size. So Amy, since your time with Syracuse, can you tell us about the organizational challenge and financial challenges that the NextGen RCM team has helped your organization solve?
Yeah, sure. So actually, when I started in May of 2018, the health center's days cash on hand was extremely low. There was less than a week cash on hand, and there were some items, some of which were billing related, some non-billing related, as it related to recognition and getting, I guess, cash flow improved, receiving payments, etc. During my tenure here, I'll say quickly, as of last month, we have a positive bottom line. We're on tap to make money this year, and then we have over 150 days cash on hand as of July of 2021. So we've improved drastically over the last couple of years, much of which is attributed to our relationship with RCM. Just notably, we were hit significantly with COVID, and the health center was one of the first ones, at least in this area, to stand up a drive-through testing service. So, as unfortunate as the pandemic was, we were able to turn around and offer a service to the community that no one else was doing at that time, which did help us, make our way through the pandemic without having to impact patient care drastically, and we were able to keep our full staff employed during that period as well.
Very impressive. Thank you, Amy, for that. And it sounds like things are going extremely well for you financially this year. Switching over to Carol. Carol, would you be able to add to this some financial challenges, organizational challenges that you saw that NextGen RCM helped you solve from your perspective in your role at Syracuse?
Okay, I'd be more than happy to reflect on when we had gone live with NextGen, dating back to 2014. Prior to that, we had been on a legacy system, which was very paper-driven. Everything actually was done manually here at the health center, which presented challenges in itself. The administration, recognizing the importance of moving forward into the electronic era, had certainly promoted us getting a new health system, an EPM system, EHR system, and also an EDR system, that all of them would have been integrated. So what had occurred, we actually had made the best decision and the best choice, in my opinion, going with NextGen. NextGen brought to us a completely electronic platform. This platform had met with resistance at first when we first had gone live. We had gone basically from a paper encounter, medical record encounter, that now the providers and the staff had to move forward and go into this electronic billing mode. At first, the providers had met with some resistance because it wasn't something that they had been mandated to do. And once they realized the importance of it, the efficiency of the NextGen system, they were very eager to be able to move forward into this electronic world. For the billing piece, our team had stacks of encounters previously, manually entering all of it, manually posting remittances. With the NextGen system, all of a sudden, certainly it became much more efficient. Our workflows and our time certainly improved. So staff, once we set up a regular schedule with the workflow, staff was able to become much more efficient with the edits with NextGen and RCM in coordination with them, getting these front-end edits, including the implementation of the rules engine. We were able to certainly decrease our denies, maximize our efficiency with the processing of the claims. So the providers also, one of the important things that they recognized with the willingness of NextGen to work with us. The Syracuse Community Health Center is a special facility. It's an FQHC, but we like to think of ourselves as unique. NextGen listened to the providers when they went from certainly a manual record into an electronic health record. Providers were a little bit perplexed and puzzled at first, but when they saw that NextGen was willing to work with us, work with them one-on-one, specifically work with their templates. Say I have a podiatry template that basically would differ from my primary care template. The NextGen team stepped in and said, all right, What are your needs? What can we do to make you more efficient? And I think that was a very, very strong selling point with making certain this EHR system succeeded, and it still is a very successful application. The providers now embrace it, and we've certainly seen much improvement. From the EPM side, our coders and billers, we certainly have seen that making certain NextGen works with us to again make sure with any changes, our ICD-10 changes, our CPT changes, they're right on top of it. They provide guidance to us, and certainly working with Mark and his team, the RCM team, we've developed a very good rapport. We hold bi-weekly meetings, whereas if there are issues, we can address them, we bring them up. They bring trends to us so that we can make certain what we're doing, we need to be doing. And just to touch base on the EDR system, because I think that's a very important part of the Syracuse Community Health Center. We have a very lucrative dental practice. In the EDR system, it interfaces well with both the EPM and EHR. So certainly that's another important factor, because NextGen addresses all phases of a patient visit, the entire life cycle of the patient visit. Again, staff, has accepted it. The training has been ongoing, and it continues to be certainly something brought up and addressed and recognized. So some of the things that had happened as barriers at first, we've certainly turned around full circle. We've gone through an upgrade, and the upgrade was very successful. And again, it's making certain that we're staying on top of all of our new regulatory requirements and guidelines. And with the help of NextGen and RCM, I feel that the Syracuse Community Health Center truly is a premier health center within New York State and within the country. We also have to thank our leadership here at the Syracuse Community Health Center. Our CEO has certainly embraced the NextGen system and is very supportive of anything that comes up, say as an enhancement or any changes, recognizing the importance that we need to succeed in this ever-changing healthcare environment.
Thanks, Carol. That was a really great summary, and thank you for always working with NextGen RCM and embracing our partnership, because I think that's what's made this a very successful partnership, is that we rely on each other. And
I truly do. And, I want to especially thank you and your team, because again, together, everyone achieves more. There's really no I in team.
No.
And we have to collaborate and just work together.
You're absolutely right. And one of those areas we collaborate on are metrics, benchmarks, and any type of key performance indicators that we want to track. So I think that's a great area where we can all talk about, because for the last 12 months, you, Amy, myself, and the RCM team have been really looking at all these key metrics and saying to ourselves, like, how can we move these in the right directions, and what can we do? So why don't we start with you, Carol? Why don't you walk through, or Amy, anybody would like to jump in here, where have you seen the most improvements when it comes to a lot of the metrics and KPIs that we've been actually tracking since you've joined, or since we've been focusing on that in the last 12 months?
So some of the items that we look at are the charge lag report, some items off of the executive summary, like you said, payment lag days. Those are two in particular where we present those to the finance committee and the board. We've been trending them since the beginning of the year to show the improvement that we've seen in 2021 with those indicators.
And Carol, are there any additional maybe metrics or reporting tools that you're tracking on a regular basis to make sure that you're hitting your organizational goals?
What we're tracking, certainly the top 10 denials, Mark, which is near and dear to my heart. We're always focusing on it. And by your reporting, which I can tell you, the reports that we're getting through NextGen RCM, they're outstanding as it relates to the AR. And I would like to note with our biweekly calls, when you provide us with that executive summary, how valuable it is to us. It gives us a benchmark, and it also lets us know where we are compared to other FQHCs, and also looking at the national average. The days in AR is something that I truly, truly focus on. Another report, though, that has been provided that both Amy and I totally focus on, and she had started it, the kept appointment no charge report, the KNAC. It's something that kind of got out of control, and by working with RCM, by your providing guidance to us, we were able to develop a process, a weekly process with our providers, letting them know be aware of what's outstanding. These are claims that we aren't able to submit out for payment. So this KNAC report, each provider receives an individual report on a weekly basis. So through the efforts of NextGen RCM, it brought to light to us, this is a valuable tool that we can use. And at first the providers saw it and, well, I processed that, I finalized it, I submitted it. By having it right there in front of them, and by having our billers and coders work one-on-one with them, we developed a very good professional working relationship. We've developed great rapport with our providers working together, so that not only did we address issues, but we worked with them. We provided training. Also, part of our bi-weekly RCM calls, tracks and trends are presented, as you well know, Mark. Spreadsheets are provided to us when we see something that's starting to get out of control. Unfortunately, a few of our payers, our high-volume MCO payers, they state, a claims in process, a claims in process. Well, meanwhile, if we don't keep right on top of it, I think they take the position, well, it's better in their bank account than ours. So we keep bringing it to their attention. It's still outstanding. We find what we need to work with them. And again, certainly working with the RCM team, we're able to identify different billing issues. And certainly with some of the changes that we're seeing as it related to COVID, I would like to address that. I feel that NextGen RCM really and truly jumped on the bandwagon, providing assistance to us. The whole COVID pandemic situation, it's worldwide. But what was so important, because we had received that special designation to become a testing facility, we really had to get everything together very quickly. What NextGen RCM provided to us was the guidance in what started out as a paper process. Through the NextGen RCM system, we very quickly worked with them, developing an electronic process. So that's one of the pluses in working with trends, and also working with the powers and the expertise of the SCHC NextGen RCM staff. Certainly with the volume of encounters that we had generated, well over 50,000 for doing the COVID testing going back to March 16th. We couldn't have done it without you. And it certainly is something to be very proud about. And as I said, working with different projects and different financial analytics, so to speak, I think that it's made us stronger financially. Our cash flow, as Amy said, has improved. We're receiving payment from some of our third-party payers within 14 days, whereas if it were a paper process, they wouldn't even look at it for 14 days. So there certainly are definite advantages to working with the NextGen RCM system, with all the enhancements that they provide, and with the expertise, letting us know, gee, we can help you do this better. And in today's world, we have to have the best. We need to stay on top of it and make certain that we're doing what we need to do.
That's a great summary and transition over to how NextGen RCM has been helping our NextGen clients with COVID, as well as the ongoing maintenance of any kind of COVID-19 related changes. Switching over to Amy. Amy, on that same note, what can you say about NextGen RCM and in the NextGen tools and technology, how they've been able to help support Syracuse during, what they had to do during COVID-19?
Well, actually, just off the top of my head, once the vaccination protocols had come out, I remember, actually, Mark, it might have been you yourself who had sent us the coding surrounding, the first and second doses. So we were able to update our system within just a couple days of that information becoming available. So, it was one of those things where we didn't even have to ask. It just automatically was addressed and taken care of. So
you're absolutely right. And that's the one thing that NextGen clients get with RCM is, yeah, we're going to work through denials. Yeah, we're going to bring things to your attention, but we're also going to make sure that you're up to speed on all the regulations and government changes so that you can rest assured knowing that when your doctors go in to see a patient, that all the billing in the back end is going to be working very effectively for you. So you don't have to worry about changing systems and understanding and interpreting things to do. And we really saw a lot of that with you, Syracuse, because you were doing so much testing in your community. We saw a lot of financials being changed based on that. So not only were you doing a great service to your community, but you were also being made whole on that so that you can continue to do that. I guess just share with how that's made an impact, not just on your community, but your organization as well, that you were really a huge resource for the Syracuse and the surrounding communities for COVID during that time.
Yes, so during that period, we were the first ones to launch the COVID testing. We did have a large hospital system who started well after we did. And then during the period in which things had kind of settled down, we moved our COVID testing from a drive-through into our facility. However, with there appearing to be a resurgence, we have to address the ever-changing need and might go back to that previous setup. So, we're here to respond in the ways in which the community needs us. The other hospital system that I guess I'll say was the second one to offer, they haven't come up with any plans in this new resurgence to go back to what they were doing. So that kind of leaves us here to do it. And, just with aligning our mission with the needs of the community, we're willing to do whatever we are called to do in order to make that available.
Absolutely. And I'd like to transition into one more slide here. And really what it's about is the dynamic partnership have with NextGen. What I'd love to hear from Amy and Carol right now is, I've worked with our FQHCs for many, many years. I've worked at an FQHC in a large capacity. And every FQHC is unique. It's different. It does something different in the community that's so much different than, that private practice across town or that hospital system. And so it's really important to find good partners that help you deliver on your mission. I'd love to hear from both of you that you could talk about how NextGen RCM has been such a good partner for you as an FQHC and why that's important.
So I guess I'll start off. I have this mantra, and I heard it from a colleague when I first started here, is that FQHCs have enough money to do what is necessary, but not always what they want to do. So just to the degree that we are able to be great at the things that we have to do and then be able to do more, the things that we want to do or areas that we feel are missing in the community, and we would be a great resource for that. To the degree that we can go above and beyond in the basic areas in order to grow our patient base and offer more services, we're always looking to do that. So especially with the last 3 years and, us making a financial turnaround, it's easier for us to do that in times like this. And a lot of that is just due to the improved results that we've seen within the revenue cycle and reimbursement processes.
That's really great to hear. I'm sure as a CFO in your organization, it's always about making sure you got to make ends meet, and knowing that you can rely on us to keep the cash coming in there, definitely hope relieves or at least makes your job a little bit easier, so you can sleep better at night, Amy.
Yes. Well, I'm not sleeping for other reasons, but this isn't one.
As long as it's not us.
So thank you. Yes.
All right, well, shifting over, Carol, I'd love to hear Carol's perspective about how we are supporting FQHCs like Syracuse for the billing process, as well as coding and everything that she has to rely on. Carol, please share your input or your perspective.
Yeah, well, Mark, thank you. I think from my standpoint, my personal standpoint, NextGen, from when we went out of the gate, truthfully, back in 2014, you were committed to making it a success here at the Syracuse Community Health Center. I feel that the NextGen RCM team really went that extra mile to make certain that this entire process was going to be a success. At first, it was a little rocky road again, just going basically from where we were at, moving into this platform that was all electronic. And NextGen went out of their way just to make certain that our needs had been met, providing us with all of the tools and the resources. And I think the partnership truly has grown in not only here in the billing world, but also in the professional world. The providers, I know some of your team, has worked with them, and they've been very glad that the relationship has worked out so well. NextGen is out there, and, they let it be known, certainly through meetings with the providers, meeting with the executive team here at the health center. I think that they know that this is a very important partnership, and NextGen in RCM certainly works at making certain that we do have all of the upgrades that for this COVID, for the vaccines, as Amy mentioned, you provide us with very timely, succinct information, not only providing it to us, but making certain that the system is up to par with what is required and what's needed. The health center goes back many years, and we're vested within our community. We provide a lot of outreach. During the COVID, I do want to mention that once the health center had been designated as a testing site for the COVID-19, through this affiliation, through the president and CEO here at the health center, with his connections through different agencies, his relationship and our partnerships, some of these local agencies, they reached out to us saying, we would like you to partner with us to provide some testing. We had some local employers that had sent their employees here to have the COVID testing. We went into assisted living facilities. We went into nursing homes. Without the expertise and the assistance truly of NextGen RCM, to be able to implement that, to have it a success, and to make certain that it was following all the regulatory requirements and guidelines, I think it would have been a much bigger challenge than what we had. But again, working together with this partnership, it worked. And what was important too, we even had local press, our local TV stations, publicizing, come to the Syracuse Community Health Center, they're doing testing. By our being in the community for so many years and having so many loyal, dedicated patients. These patients continue to come here, but we also have had patients that had left and they're coming back now. Why are they coming back? They get the quality care. We provide the service to them, irregardless of their ability to pay. And also, this may sound a little strange, but we have a system in place now that a patient can call, schedule an appointment. They'll get that reminder call. They're processed through timely and efficiently via the NextGen appointment scheduling check-in application. The claim is submitted on a timely basis because the provider does his or her job. And guess what? The claim gets paid. The patients 99% of the time have a very seamless patient visit. Life cycle of that patient visit, inefficiently provided quality service, claim billed out, insurance pays, happy patient. Certainly these to me are the strong points with the NextGen RCM system. And as I said, we are vested in the community. They know Syracuse Community Health Center. We've been around for years, and we're going to remain in business, and we're going to be remaining here for another 100 years, again, providing that quality care, but also having a quality process in place that proves that we know what we're doing.
I agree with you there, and I believe you'll be around for a long time. And I'd like to say this, that Syracuse is, as well as Amy and Carol, I mean, you're very much open to all the data and the presentations and the dashboards and the reporting that we bring to you. You're open-minded, you soak it all in. And what's most impressive is you take that information back to your organization to drive change. And I think that's what makes you so successful in all things that you do. And the community has to be, as you stated, very happy to have you in their community, supporting them for their healthcare needs. And it sounds like they appreciate Syracuse. And I'd just like to end with that NextGen appreciates your partnership. You are a great partner. You make us better, and it's really our motto here at NextGen is we do believe in better, and we want to even continue to do better for you in the future. So as we come up here on our time together, I'd just like to thank Amy and Carol from Syracuse Community Health Center for providing their expertise, their time, and their experience with NextGen and NextGen RCM Solutions. So thank you so much, Amy. Thank you so much, Carol, for your time today. And we look forward to continue to serve you in the future.
Thank you, Mark.
Thank you, Mark. Thank you very much.